Hey, Dr. Kyle and Dr. Peter here with Shift Health Center. We just wanted to share this information today on something that we look at when we have new patients coming in, whether they're dealing with any sort of spinal issue or spinal injury, neck pain, back pain, headaches, that type of thing. One thing we look at is the PTSIA angle. We're able to measure that off of X-ray. For short, we call it the pizza angle. That's the easy way to remember it. So, Dr. Peter, why do we look at the pizza angle? What is that about?
Yeah, it's a great question. So a lot of people aren't familiar with that. It's not something obviously you didn't hear very often. So the reason it's important to us though is because it's actually used coming from the X-ray. And what it does, it tells us information as to what your body is like, your normal alignment and how it's structured. And so basically a lot of people will think you have to have a perfect curve in the neck. That's not necessarily true. This pizza angle is actually like measuring your body and its ability of what that curvature should be, because it is different for each person. So if we're not measuring that, then we don't even know what your curve should be to try and get you to that. So that's why it's super important that we know all the facts before we just start trying to make all these changes structurally to a spine.
Yeah, so what's cool is based off every person's anatomy, everyone's a little different. So what we're saying is not everybody's gonna be able to get a perfect 40-degree curve in their neck. We know the curve in the neck is very important because it's proven in research to increase and have proper blood flow to the brain if we have a good curve in the neck. If we don't, we're not getting adequate blood flow to the brain. We know it prevents neck pain and neck issues in the future for life if we have at least a 20-degree curve in the neck. But the problem is, some people aren't even looking at the curve in the neck. They don't consider it a problem, or they're not taking the time to even diagnose that. Second of all, some people don't know how to correct the nerve in the neck, or the curve in the neck, and it's just a really important piece. And then the other aspect is, like we said, not everybody is going to have a perfect curve. So we can actually look at those points, the pizza angle that we measure on the X-ray, and we can determine, should you have a 20-degree curve, should you have a 30, should you have a 40, and then we have different methods in and out of the office that can get you there and restore that curve. So I think at the end of the day, it's about customized care. It's about looking at each person and their anatomy differently, because not everybody's the same, and that's definitely something we pride ourselves on.
Absolutely.